shifting fertility. You would think, wait a minute, cannabis is bad for fertility. I'm going there with the lubes. Cannabis is bad for fertility, right? Because it stops sperm or something I heard about when I was a kid. And that's true, actually. If you look under a microscope, you will see cells that have cannabis infused in them. They move a little bit less rapidly. They're not stable, they're not dead, they just move a little bit slower. And the same thing is true if you look at women's fallopian tubes. They have what are called fibria, little fingers, that are supposed to lull the ovum to the uterus. If you give those cannabis, they stop moving as quickly. They're a little bit more rigid. So if you stopped your analysis there, boy, is it clear cannabis is bad for fertility. And that's the reality. If you zoom out, if you have a wherewithal to look at public health data, publicly available maps of regions of the world that have cannabis that's prevalent or have fertility information that's available, you can just do a simple overlay. Where are the countries that have good fertility? Where are the countries that have access to cannabis? Anybody want to venture a guess? I'm setting them up. The countries that have extremely high rates of cannabis are also the ones that have the most fertility. And why is that? Because people feel more comfortable. They're less anxious. They're having more sex. It's not just about looking under the microscope and what reality that tells. Yet our whole culture has this single-minded view.